My name is Srikanth Sadhu. I'm one of the interventional cardiologists at the Advanced Cardiovascular Institute, where office is right in the Atrium Medical Center. Any catheterization means you're putting small tubes through the arteries to the heart and injecting liquid dye to take your pictures of your heart arteries. It can be done from the groin artery, the femoral artery, or it can be done through the radial artery from the wrist. The wrist artery is been done for a long time, but it is catching up in US. Only less than 10% of the cases in this country are done through radial access or the radial artery access. We have more and more studies coming up now showing that the risk of bleeding is lower with the radial access. The patients can go home earlier, the quality of life is better, the costs are being cut down with the radial procedures because you can send home earlier. You don't have the same nursing cost as you would need with groin. If you do from a groin, you have to lie on your back for about anything between 2 to 10 hours. And there is significantly increased risk of bleeding from the groin, even though it's still low. Compared to the radial, there's a lot more compared to the radial when you do from the groin. And we have more studies showing that that is the case now. There's most recently a study that was published, a randomized controlled trial showed that 63% reduction in the major bleeding, and especially in the setting of a heart attack, there is significant reduction in mortality, means chance of death is also reduced if you compare to the groin if you do from the radial axis. So more and more people are moving towards the radial because of cost, because of comfort, because of patient requisitions. Most procedures can be done through radial. 99% of the things that you do from the groin can be done through the radial artery. The success rate is more or less the same when you go from the wrist or from the groin, about 95% in major studies. You cannot put much bigger catheters than 6 French, what we call, from the wrist, but 90% of the procedures we do are from the 6 French. So we can do all those things from the wrist. We can do balloons, we can do stents, we can burr the blockages with what we call the rotablators, all from the wrist itself. There are very few things that you cannot do from the wrist. The limitations are not just the catheter size. The limitations are the radial artery, because of its being small, it is prone to spasm, means it clamps down on the catheter. That makes the procedure more difficult. You need a little bit more learning curve from the physician point of view. It is more technically challenging. You have a 100 to 200 cases learning curve before somebody can become proficient in doing these cases. So those were the main procedural limitations. And also, if you want to talk about where you should not do radial, is if somebody has a kidney disease and the plan is to do dialysis in them in the next year, and the radial artery is sometimes used as a conduit to do the dialysis, then you should not touch the radial artery so that it can be preserved for future dialysis purposes. Similarly, if somebody is planning on having a bypass and the surgeon wants to do the radial artery, take the radial artery as a bypass graft, then you should not touch the radial artery because you can jeopardize the future use of the radial artery. There is no added risk compared to the femoral artery. Anytime you do a heart cath, the risk inside the heart is exactly the same as the groin artery. You have 1 in 1,000 risk of any major complications you can think of, either from the groin or from the wrist. The risk of bleeding is much less compared to the groin. The only complication that you should be aware of is severe spasm, and if you're not aware of it and you try to thread catheters through a tightly narrowed spasmodic artery, that's what clamped down artery, then you can cause problems. That need to be aware of it. So a gentle approach, as long as you're aware of all the anatomical differences like the bends, curves, coils in the area, you can do the radial heart catheter with much less risk than compared to the groin. The radial catheterizations are done at the cardiac cath lab at the Atrium Medical Center. The procedure takes less than half an hour to do the whole thing. Like the groin, the access takes about 2-3 minutes and the procedure takes about 15 to 20 minutes. Once the procedure is done though, the recovery time is much shorter compared to the groin access. It's less than 2 hours, even if you get a stent done, which is more than 10 hours in the situation from a groin access. Diagnostic heart caths, where you just look for blockages, is outpatient procedure strictly. Most interventions, means the stents and balloons and stents that are done in America, are still in patients, especially if you're doing from groin. You stay overnight and they go home because of the risk of bleeding. Because you're doing a balloon or a stent, you give a lot of blood thinners, and that increases the risk of bleeding from the groin significantly. But from the wrist, a lot of places, including where I did procedures before, we send patients the same day because the risk of bleeding is negligent from the wrist. So you do the procedure in the morning, you observe them for about 5-6 hours, and they've been walking even during this time. You get some blood tests done. If everything's fine, they go home within 6 hours on the same day, and that significantly reduces nursing costs, the hospital costs, and even the patient comfort who they want to go home the same day. That's one of the biggest advantages of stents being done through the radial access.